Welcome to Copenhagen Academy of Medical Education and Simulation. My name is Sandra and I'm a medical student, and today I'll give you an introduction to the role as an operator and simulation assistant in a simulation center. We will introduce you to several topics. First, we will give you a basic introduction to the different functions related to running a simulation scenario. Secondly, we will show you the simulation setting, the mannequin itself, and the hospital room setting. Afterwards, we will show you some short scenes from a simulation, both from the operators and the participants' point of view. In the end, we will dig a little deeper and try to give you an understanding of what goes on behind the scenes. How do we communicate with the instructor, and how do the scenarios develop over time? We hope this video will give you a good basic understanding of what an operator's role is during a simulation scenario.
Hi, my name is Ellen and I'm a medical student here at CAMES. I will give you a short introduction to the operator room. The most important equipment in the operator room is the computer that controls the mannequin and the computer that controls the recording. Our most important role as operators are speaking for the mannequin and controlling the vital parameters, such as pulse, blood pressure, saturation, and respiration frequency. Besides talking for the mannequin, the facilitator has the option of addressing the room directly through this microphone. Later on, you will see an example of a short simulation, but before that, my colleague Theo will give you an introduction to the simulation room.
Hello, my name is Theo. Today I'm going to show you a normal simulation room. In a normal simulation room, you have a mannequin, a teleprompt monitor, and all the normal equipment you would have in a normal hospital room. When going through the simulation room, you use the same assessment tools that you would use to assess a patient. Here at CAMES, we use the ABCDE approach. When introducing a mannequin, we start by introducing A, or the airways. We tell the participants that when the mannequin is talking, we know that the airway is patent.
Hi, I'm Cindy.
We also tell the participants that they can use suction devices and airway devices. When introducing the B, we tell the participants to look for chest movements, listen to lung sounds with your stethoscope, and apply a pulse oximeter. When introducing C, circulation, we tell the participants that they can palpate a pulse and they can measure a blood pressure. When simulating with a mannequin, there are some limitations. For example, skin color, peripheral venous axis, and pupillary response. It's the facilitator's job to make sure that the participants overcome these limitations. After having introduced the mannequin, we introduce the rest of the simulation setting. Generally, simulation settings strive to be as realistic as possible. In this instance, we try to replicate a normal hospital room. This we do with the phone to communicate with the outside world and a fully equipped medical cabinet. Generally, when introducing a simulation setting, we tell the participants that it's important to use the same amount on a simulated procedure that you would do on a real procedure. When introducing the simulation setting, we tell the participants that this is a safe environment meant for learning, and that all video recordings will be deleted after the debriefing. Hello, Sarah. How are you today?
Not very good.
How are the colors of the patient?
The patient is pale and sweaty.
Hello? Yes, I could use an extra nurse in room 2. Thank you. Hi, could you please put on a pulse oximeter?
Yeah.
Thank you.
Make the patient a bit worse.
Before you start a scenario, it's important to schedule with the facilitator what kind of scenario this will be. This includes the general structure of the scenario, what kind of patient are we assessing, what should the start values be, when will the scenario escalate and de-escalate, that is, when will I turn up and down for the vital parameters, and the general time frame of the scenario. The critical point of every simulation is when and how to escalate and de-escalate. This is something that has been talked through beforehand with the facilitator, but it's very important to maintain an ongoing communication so you can address occurring events during the simulation. In the simulation you just saw, there was a very good example of this.
Make the patient a bit worse.
The example you saw here was very clear, but it could have been a nod or another form of nonverbal communication. The key word here is to be attentive of the communication between you and the facilitator.